Ghoshal earned his PhD degree in engineering from Jadavpur University in 2014. He is currently working as Associate Professor in the Department of Information Technology, St. Thomas College of Engineering and Technology, Kolkata. He has teaching experience more than 13 years. He has organized and chaired several special technical sessions in lots of international conferences. His research interest is in the area of machine learning and pattern recognition. He has plentiful number of referred publications in international journal papers, international conference papers, and international book chapters. He has also taken important role in organizing different technical activities in St. Thomas College of Engineering and Technology. We are very much pleased that he is with us in today's session. Now I would like to request Dr. Ghoshal to start his session.
Now today I'm giving a presentation on this topic, that is COVID-19 unfamiliar facts. First I'm telling that though my specialization is machine learning, pattern recognition in this area, but still I feel that the needs for this time is the know something about this COVID-19 pandemic, because it is a tough and challenging situation which is caused by COVID-19, and we are in home since near about from the middle of March. So obviously there is I feel some requirements to give some light on this topic of the COVID-19. Now these are the topics I'm going to cover. Starting from the basic introduction of this virus which is causing this COVID-19 disease, that is SARS-CoV-2. Then its natural history, risk factors, diagnosis of this COVID-19 transmission, why we require stopping the transmission is required, contact tracing, next identifying the high-risk situations. Then coming to the technological part, that is the examples of technology that can be used for contact tracing, use of Arogya Setu app, that why we should use this one and how we should use this one, and lastly the machine learning for COVID-19 data analysis. So before starting the whole content of the slide, whole content of the presentation, I would like to share the general scenario of the COVID-19 pandemic. There is a global scenario. This information is collected from the website of WHO. If you see this total diagram, you see that there is different colors is being there, and which is indicating the number of cases reported in the last 7 days. And you see that there are three colored, most densely colored is, one is USA, another is Brazil, and another is India, because all these three countries are the worst affected countries in the world for this COVID-19. And all of them is almost reporting more than 1 lakh cases in the last 7 days. Now I'm going to the next actual content, that is the SARS-CoV-2 virus. We should first know that what is this virus. What is coronavirus? That it is actually a large group of virus, and we require a powerful microscope to see them, because it is not visually, it is with the naked eye. And you know that this corona means the crown, because if you see that the picture of this corona, there are some spikes there which is called as the crowns, and that's why it has been called as the corona. It can infect a wide range of mammals and birds, and obviously being a mammal, we are also getting infected. And while we are getting infected, sometimes it may cause the mild respiratory illness, and sometimes it may not create any problem, and sometimes it may create severe problem. Now this is the picture of the coronavirus, which is released by the US Center for Disease Control and Prevention, that is shortly CDC. It is the first electron microscopic image of an isolated coronavirus image. Next, this is a SARS-CoV-2. It is a new coronavirus. It is assumed, or it is being informed by the WHO that it is being originated from the bats, and it can be transmitted between the people. That means if one person is getting infected with the SARS-CoV-2 virus, so it can be spread from that virus from one person to another person. Now previously, That means before this COVID-19 pandemic, there are also two coronavirus also came in the world, which was about to create the pandemic situations, but those did not yet created this one. The first one, that is a severe acute respiratory syndrome, shortly termed as SARS-CoV. It was emerged in Guangdong in China in 2002. The next one was Middle Eastern Respiratory Syndrome or MERS-CoV. It was emerged in the Middle East in 2012. And the last one of this family, that is the SARS-CoV-2, it was emerged in Wuhan, China in 2019. Actually, the first case was reported in China in 2019 December, that some people were suffering from unknown cause of pneumonia. Later, after doing the research work, it has been identified that it is being caused by the SARS-CoV-2 virus. Then the natural history. It is a virus that causes the, actually the name of the virus is SARS-CoV-2, and the name of the disease that it is generating, that is called as the COVID-19. And one who is getting infected, it doesn't mean that if I am getting infected with the SARS-CoV-2, always I will feel sick. No. Sometimes we may feel sick, that means some people may get sick and some people may not. So whenever this question is coming, the infection of this disease, of this by this particular virus, obviously some questions are getting coming in our mind. The first question, that what are the signs and symptoms? Like, as it is a disease, we obviously should know what are the signs and symptoms of this particular disease, how long the sickness lasts, and how long the infected people can spread the virus. That means how long they are becoming infectious. The first thing, there is the signs and symptoms. The science means that this is the objective measurements to characterize the illness during the physical examination. That means by clinical observation or by any pathological test or by any other means, that means those who are suffering, some people who are testing the people, they will reporting of this particular symptom, this particular signs. What are? That is the temperature, that means the temperature will be high. Next one is the breathing faster than usual, that means that whatever the breathing rate in our normal case, that is 16 to 18 times we are breathing in per minute, it is greater than that. Symptoms means that which are, these are the actually the complaints which the patients are reporting. That means who is already suffering from this particular virus, those people are reporting this type of symptoms. The first one, that is fatigue. Next one, nausea. Third one, loss of taste and smell. And lastly, muscle ache. But remember that fever is both sign and symptom. That means fever is both being reported by the people who is already been suffering from this particular disease, and also it is being observed by the clinical observation of the particular patients. Now, signs and symptoms, it can vary because some people have no symptoms and they are actually being treated as asymptomatic. And some people will be having the mild disease and some people have the serious disease. That means the three kinds of situations we can observe who are infected with COVID-19. What are the common signs and symptoms? The fever, the temperature expected to be greater than 100.4 degree Fahrenheit, tiredness or fatigueness throughout the day, chills, muscle pain, cough, loss of taste or smell, difficulty in breathing, headache, and sore throat. All these are the common signs and symptoms. And nowadays, WHO and CDC are also suggesting to include the diarrhea also as the signs and symptoms. Now, obviously, as it is a disease, there should be some symptoms which is specific to some particular disease, this particular disease. Also, there are some symptoms which is not specific, but whenever we are getting infected with this particular disease, this type of symptoms are getting shown, so, which is common with the other diseases also. Those are fever, cough, and muscle pain. These are the non-specific because it can happen in any other disease also. So that means if you have these things, you cannot ensure that you are suffering from this COVID-19. But WHO and John Hopkins University is saying that the specific of symptoms of the COVID-19 is the loss of ability to taste or smell, because it has been observed that near about one third of the total infected people in the pan world, they are reporting of this type of symptoms. They are saying that this is very much uncommon in case of the other infectious case. Now, severe signs and symptoms, that some signs and symptoms means you can see that the disease is becoming more severe. Obviously, in any case, in any disease, if I see some signs and symptoms which are arriving, or it is the intensity of a particular signs or symptoms is getting deteriorating, that means suppose you are suffering from the temperature and the temperature is increasing gradually, or if you have the cough and the cough is not decreasing, rather it is increasing. So sometimes this type of thing that you can think of that it is you can treat that the disease is a progressive infection. That means it is in the progressive nature and it causes the severe damage. So those observations may be the blue leaves of face, which indicates that the body is not getting the sufficient amount of oxygen. Next is increased rate of breathing, shortness of breath, chest pain while breathing. That means, and lastly, waking up during sleep with the shortness of breath. These are the common signs and the symptoms which indicates that the situation of the patient is going to be severe. Next is, first you should know that because it is being infected, as it is being infected by this virus, so obviously you should know that what is its incubation period, because we know that the virus cannot live alive in its own. It needs some host. Obviously our cells, that is the cells of our body, is becoming the host of this particular virus. So when this particular virus is getting infected, that means it is entering in our body, it doesn't create the infection at that time. It requires some time to get activated. So this activation time, that means when it is getting infected and when it is started to working, that means what it is, this time gap is called as the incubation period. It is the time when from someone is infected until the symptoms develop. That means today, suppose I have got infected with this particular virus, and after 5 days I am showing some symptoms. Then this 5 days is being called as the incubation period. Generally, it is ranging from the 2 to 14 days, and within 5 days, almost 50% of the people are getting infected or getting showing some symptoms. And by 14 days, 95% of the people are showing the symptoms, but the 5% remain asymptomatic. SARS-CoV-2 infectious period means how time, it is the time span that how much this particular virus can spread. That means if you are infected with this one, how long you are infectious, that means how long you can cause the infection to be spread to the other people also. This is the infectious period. It is saying that it is a time during which the someone infected with SARS-CoV-2 can transmit the virus to the other people. Generally, it begins 2 days before the start of the signs and symptoms. This is the most dangerous thing is on this particular disease, because suppose on the today I am showing the signs of the symptoms of this disease, like cough, sore throat, etc., etc. But actually, I have become infectious 2 days before. So that is the problem. That means you don't know that when you are actually infected and when you have become already infectious. That thing is the most dangerous thing of this particular disease, because generally when the signs and the symptoms are beginning, like in influenza or any other cold and flu or something like that, that time you are becoming infectious. But in SARS-CoV-2, you are becoming infectious 2 days prior to this, which is most dangerous, and you will generally, it will lasting for the next 10 days. But if your situation is going decreasing, that means if you are going to the mild from the decreasing to the severe situation from the mild situation, then it can long last for the 2 or more than weeks. And obviously, when the infectious period is ending, that is the last 10 days, generally it is assumed that the last 10 days from the day of the you are reporting the illness, your symptoms are improving. That means your cough is decreasing, sore throat is decreasing, or chest pain is decreasing, like that. And there should not be no fever in the last 3 days. If it has been happening, then you can say that this particular period, the particular patient is coming out of the infectious period. The problem is with the asymptomatic people, because they never show that when the signs and the symptoms is becoming visible. So you cannot see or you cannot find that when their infectious period is already started and when the infectious period is already ended. It is a timeline. Suppose on this, it is a calendar days from the 0 to 30. From the 0th day, if a particular person is getting infected by someone to some other people, and then the person is entering into the incubation period, but without any knowledge that he or she is already getting infected. signs and the symptoms after 2 to 14 days, but typically in case of the 5 days, you are showing some mild illness, which is going to last for the 10 days. And if the situation is not getting improved, then you are moving towards a severe illness, which can last 2 or more weeks. Now, infectious period is there. The, the person is becoming infectious on 2 days. One, on the day when the person is noted, when the person is first noticing the his sickness. That means, suppose from today, I am feeling that my sore throat is there, I am started to cough. So on that particular day, I am becoming the most infectious. And also, when I am feeling sick badly, that means suppose after 5 days, I am feeling very bad situation. On that day also, I am becoming the most infectious. But the other days, your infectious rate or the coverage infectiousness is less, and obviously, this contagion is lessens with the time. Now, what are the risk factors for the severe disease? Severe disease means that whenever you are covering up the mild symptoms and you are entering to the severe disease. And also some biological factors. The age group, it is playing a good factor of the very risk factors. The some age groups for the people who are generally greater than 65 years age are in the most increasing risk. That means they are in the most risk zone. And also the people who are obese, they are also in the very much risk zone in case of the COVID-19. But it has been observed that the some young and healthy people, they very rarely feel ill. And children is very much unlikely to be severely ill because we have the basic immunity system of our body strong. Because in the higher age, this immunity system is getting decreased, and also it has been observed that the obese people, they are also having the immunity is lower compared to the healthy people. Other some medical conditions is also increasing the risk factors. The first, that is actually these medical conditions may be called as the comorbidities, like diabetes, hypertension, any kind of lung disease, that is asthma, emphysema, or COPD, heart disease, liver disease, kidney disease, and weak immunity system due to taking any drugs. That means if you are under some particular medication, then it may happen that your immunity system is getting weakened because of those drugs. So they are also in the risk situations. Risk factors to death. That means if it is a worse situation, that means if you are not getting improved, then your situation will not getting improved, and you are going towards the worst scenario. And how this disease can heal, because actually you know that at the first I have told that it is a type of pneumonia. In Wuhan also they are reported that the unknown cause of pneumonia. So actually this particular virus is targeting your lungs. Initially it was in your throat or something or in this part, and later it moves towards the lungs. So whenever it is within the throat area, then it can be controlled, but whenever it is entering into the lungs, then it is becoming a challenging situation. Why? Because the lungs, if it cannot recover, then the patient cannot breathe their own and causing the lack of oxygen. And if the lack of oxygen is there, so then it can damage the other organs of your body, like causing this heart attack, kidney failure, strokes, and clotting disorders, etc. Lots of problems will be appearing if the sufficient amount of oxygen is not getting in your body. Death is rare among the young and the healthy people because their immunity system is good, so they can fight with this virus very well. And if you see the death rate with the different age people, you see that the 65 to 75 years, it is 2 to 5% is dying. 75 to 85 years old, the death rate is 4 to 10%. While greater than 85% with the age, it is greater than 10%. So it is increasing with the day, with the age. Now, what are the treatment for COVID-19? There is actually no specific treatment to cure the COVID-19 till now. The lots of efforts are being paid to find out what are the treatments, like vaccine, etc., etc. All these things is going on, but till now there is no specific treatment for this COVID-19. What the thing is being done, because obviously you know that if you can can ask, or it is a common question, that if there is no specific treatment, then whether people are getting admitted in the hospital and how they are getting cured from there, because as it is no specific treatment. So actually what has been happening in the medical health, on the medical institutes, that means it may be nursing home or whatever, they are trying to support your body's functions so that the body's normal immunity system can fight with the infection. So that means if you can boost up your immunity system, then you can fight with the COVID-19, and that is the till now, this is the only remedy to fight with the COVID-19. That means to boost up your immunity systems. But if your lungs is, you are suffering from different lungs disease, or your lungs is getting deteriorated, lung situation of lungs, then you require some artificial mechanical ventilation situations which can support the lungs externally, like breathing machine, ventilator, like that. Main thing is that you have to provide a sufficient amount of oxygen into your body. If the lungs can do it itself, then it's fine. Otherwise, external support is required. Diagnosis in the COVID-19. There is specifically two tests. Initially, there was two tests. That is one test, that is the diagnosis test. It is the polymerase chain reaction of the PCR test, also called as a molecular test. What it does, that it gives a sign that the virus is reproducing in your cells. That means it is present in your body and it is becoming even more active. And another one, that is the antibody test. Antibody test is to identify the antibodies to the virus. That means if you are already infected with the virus, then some kind of antibody is going to be developed in your body to fight with this COVID-19 virus. That means the SARS-CoV-2 virus in future. So if it is collected from the blood, and if it is found that it is present in your blood, that means you have some fighting immunity, or if you have some fighting power with the SARS-CoV-2. But till not, it has been known that how long you can fight with this antibody. This is the first one, that is a diagnosis test, that is RNA detectable. It has been collected from the swab, either from throat or this part. And another one is the antibody test, that is the immunohemoglobin, that is the common antibody, that is the IgG. It is detected from the blood. This PCR test is usually done to test people who are having signs and the symptoms, that means who are active patients, and to detect to RNA, that means whether this virus is present or not. And also, apart from the swab from the nose or throat or mouth, saliva can also be considered. Now, for the past infection, this antibody test is being done. Generally, what I have told, that the immunohemoglobin is getting formatted if you have suffered or if you are infected with COVID-19. That means if you are infected, infected with SARS-CoV-2. After the infection, 10 to 14 days, your body starts to produce this immunohemoglobin. So if this immunohemoglobin, that means IgG antibody, is present in the blood test, so that means you have some fighting power with the future SARS-CoV-2 attack.